everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you all from the world of medicine. The use of hormonal contraceptives and their effect of mental health, whether it prompts suicidal thoughts or not. Women, especially younger age group, have higher rates of depression and attempted suicide rates than men of similar ages. Now, many women using such hormonal contraceptives, especially the contraceptive pills, report mood swings or changes as a side effect. Now, initial reports from 2018 and 2020 had indicated that the use of hormonal contraceptives were associated with a higher number or rather risk of suicides and suicide attempts. A recent study shows that the higher rates of attempted suicides in women using hormonal contraceptions, this rate is usually lower than in women who do not use hormonal contraception at all. The study was presented at the European Congress of Psychiatry. The results from the study were seen from around 5 lakh women, which represents around 50% of the total number of women in the 15 to 49 age group. Half of these women had used the hormonal contraceptives, including pills, implants, patches, and even rings. The research team found that attempted suicide rates between hormonal contraceptive users and non-users were similarly higher in women between the age group of 15 to 19, but suicide rates dropped in older age groups with a greater drop in the hormonal contraceptive user group relative to the non-user group. In total, the researchers saw 474 cases of attempted suicide in women who didn't use hormonal contraceptives at all. Women not using contraceptives had a 37% greater odds of attempting suicide in comparison with those using the contraceptives. The guidelines for weight loss surgery. Weight loss surgery improves or rather puts into remission the type 2 diabetes. It also helps in reducing heart attacks and stroke and often results in significant and durable amount of weight loss. But a new study finds outdated guidelines that have been issued by the National Institutes of Health more than 30 years ago may be stopping a large portion of patients with a lower BMI who could otherwise benefit from having the surgery or even considering it as an option. In the retrospective study that was presented at the American Society for Metabolic and Bariatric Surgery's annual meeting, the researchers found a little more than 8,100 weight loss procedures, either a sleeve laparoscopic gastrectomy or a laparoscopic Roux-en-Y gastric bypass, were all performed on patients with class 1 obesity. The researchers theorized that surgery only should be offered to those with a BMI of 35 kgs per meter square or rather more, rather than newer and recent guidelines that lower the BMI cutoff to 30 for patients with an obesity-related disease such as type 2 diabetes. Hence, they added that the National Institutes of Health guidelines from 1991 are definitely outdated and its recommendations do not reflect decades of data regarding the safety as well as the effectiveness of such metabolic and bariatric surgeries. Nor does it take into consideration the development of such laparoscopic procedures that make the surgery less invasive and much safer. How weight loss helps in cutting down on risks of cancer and even mortality. According to a new study that was presented at the American Society for Metabolic and Bariatric Surgery's annual meeting, individuals with obesity were at least 2 times more likely to develop certain types of cancer and 3.5 times more likely to have their mortality rate from the disease than those who underwent the weight loss surgery. The researchers found that after having the weight loss surgery, patients saw big reductions in the incidence of breast cancer, gynecological cancer, kidney cancer, brain tumors, lung cancer, and even thyroid cancer. The 10-year incidence of any new cancer in the bariatric group was much lower, and the 10-year survival rate was much higher than the non-surgical group. The retrospective study included 1,620 patients who had either underwent a gastric bypass surgery or a sleeve gastrectomy. The researchers estimated that surgical patients lost about 60% of their excess weight at 10 years period. Therefore, the researchers concluded by saying that weight loss surgery has proven to be the most effective long-term treatment for obesity and is now definitely being increasingly looked upon as a preventive treatment not only for cancer but for heart diseases, stroke, and even type 2 diabetes. How heavy weight or obesity reduces the risk of knee replacements. A recent research has found that more than half of Australians who underwent knee replacement for either osteoarthritis were obese, thereby increasing their risk of having the operation done at a very younger age, especially if I talk about women. Now, the study that was conducted by the University of Queensland's Rural Clinical School compared the data of approximately 56,000 patients who underwent a knee replacement for osteoarthritis, out of which 57.7% were classified as obese. It was observed that obese women aged 55 to 64 years were up to 17.3 times more likely to undergo a knee replacement than their healthy weight counterparts, while obese men in the same age group were up to only 5.8 times more likely to undergo. The obese patients with the highest BMI ratio were also 7 years younger on average when they had a knee replacement surgery done compared to the normal weight individuals. Modest weight loss was also found to effectively reduce the knee osteoarthritis symptoms, and obese patients who maintained a 10% body weight loss experienced significant improvement in pain and function. Therefore, it is estimated that by 2030, it's expected more than 161,000 knee replacements will be conducted annually. Hence, urgent action is needed at a national level to change the approach towards reducing obesity. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.